This is a diagram of the section of the skin showing the epidermis, the dermis, the subcutaneous layer, the deep fascia and the muscle layer. Numerous nerve endings for receiving different modalities will be present in these different layers of the skin, and they can be classified as free nerve endings, follicular nerve endings, Merkel cell neurite complexes and encapsulated nerve endings. Let's see one by one. The first one, free nerve endings. As they run towards the skin surface, many sensory fibers shed their perineural sheath and then their myelin sheaths before branching further in a subepidermal network. The Schwann cell sheaths open to permit naked axons to terminate between the collagen bundles or within the epidermis. And these free nerve endings, majority of them, they function as the thermoreceptors and the nociceptors, that is pain transducing units. Second one of the nerve endings will be the follicular nerve endings. Just below the level of the sebaceous glands, myelinated fibers apply a palisade of naked terminals along the outer root sheath epithelium of the hair follicles. Outside this is a circumferential set of terminals. Each follicular unit supplies many follicles and there is much territorial overlap. Follicular units are rapidly adapting. They fire when the hairs are being bent, but not when the bent position is held. Rapid adaptation accounts for our being largely unaware of our clothing, except when dressing or undressing. The third one in the nerve endings will be Merkel cell neurite complexes. Expanded nerve terminals are applied to Merkel cells or tactile menisci in the basal epithelium of epidermal pecs and ridges. These Merkel cell neurite complexes are slowly adapting. They discharge continuously in response to sustained pressure, such as while holding a pen or wearing spectacles, and they are markedly sensitive to the edges of objects held in the hand. The fourth type of nerve ending will be the encapsulated nerve endings. The capsules of the three nerve endings to be described comprise an outer coat of connective tissue, a middle coat of perineural epithelium, and an inner coat of modified Schwann cells or teloglia. All three are mechanoreceptors transducing mechanical stimuli. What are the different type of nerve endings which comes under the encapsulated nerve endings? They are Masonry's corpuscles, then Ruffini endings, then the Pacinian corpuscles. We will see into one by one. First one, Masonry corpuscles. They are most numerous in the finger pads, where they lie beside the intermediate ridges of the epidermis. In these ovoid receptors, several axons zigzag among stacks of teloglial lamellae. Masonry corpuscles are rapidly adapting. Together with the slowly adapting Merkel cell neurite complexes, they provide the tools for delicate detective work on textured surfaces such as cloth or wood, or on embossed surfaces such as braille text. Second one of the encapsulated nerve endings will be the Ruffini endings. They are found in both hairy and glabrous skin. They respond to drag or shearing stress and are slowly adapting. Their structure resembles that of Golgi tendon organs, having a collagenous core in which several axons branch liberally. The third one of the encapsulated nerve endings will be the Pacinian corpuscles. They are the size of rice grains. They number about 300 in the hand. They are subcutaneous, close to the underlying periosteum, and numerous along the sides of the fingers and in the palm. Inside a thin connective tissue sheath are onion-like layers of perineural epithelium containing some blood capillaries. Innermost are several teloglial lamellae surrounding a single central axon that has shed its myelin sheath at the point of entry. Pacinian corpuscles are rapidly adapting and are especially responsive to vibration, particularly to bone vibration. In the limbs, many corpuscles are embedded in the periosteum of the long bones. Pacinian corpuscles discharge one or two impulses when compressed and again when released. In the hands, they seem to function in group mode. When an object such as an orange is picked up, as many as 120 or more corpuscles are activated momentarily, with a momentary repetition when the object is released. For this reason, they have been called event detectors during object manipulation. Generally, the digital receptors are classified as follows. They are: the Merkel cell neurate complex is slowly adapting type 1. Masonry corpuscles, they are rapidly adapting type 1. Ruffini endings are slowly adapting type 2, and Pacinian corpuscles are rapidly adapting type 2.